I'm Russo, president of SEIU 888. I want to welcome you all here. It's great to have you here. You're always welcome to use our resources. I'm going to be around all day. Have a great meeting. If you need anything, don't hesitate to ask. Have fun.
Thank you, Mark. We are very honored to have you here. You have come from across the state with a shared mission of ending obesity and ensuring the health of our residents, particularly those whose health has suffered the greatest: low-income immigrant workers, immigrants, people of color. And we actually have a very exciting agenda. We will be releasing the findings from our study exploring the link between working conditions of low-wage workers and weight gain obesity. We will be hearing from a distinguished panel who bring a wide range of experiences, and equally important, we will be exchanging with each other in small groups, so we can leave here today with new ideas and new collaborations for addressing this epidemic of obesity among lowest income residents. So I became involved with this effort of addressing obesity because of my discussion with low-wage, hard-working workers like Maria. So Maria came to the Worker Center with her co-workers about 2 years ago, complaining about the amount of rooms the new management forced them to clean. From 15 rooms a day, the new management ended up increasing the amount of rooms they had to clean to 30 rooms a day. Maria didn't have time to have lunch or breaks because they needed to finish their work to clean up their rooms in the 8-hour shifts she had. Maria and her co-workers began feeling sick and started using medicines to reduce the anxiety, the stress, and the depression that their work was causing to them. Maria also noticed that she gained weight and she felt her life change forever. And now I would like to introduce one of our partners who will be sharing with us some of the findings. Her name is Nicole, which is the Associate Professor at UMass-L, Department of Community Health and Sustainability, who will be presenting an overview of the methodology and key findings.
That word on the slide, participatory, could not be more true than what happened over the course of this entire project. And we really relied on Marcy, her team, PWA, their team, to really make this happen, and SEIU 888 for allowing us to use the facility. So just a fantastic opportunity. So I'm just going to lay out some of the basics about the research, and then certainly I think the more robust part of the program is really hearing from each other and sharing with each other our own experiences and how perhaps the findings of this particular study perhaps intersect with the work that you do currently, and then even more important than that, how it's going to impact the work as we move forward. So the research objective that we had starting out many more months ago than we would have thought was to explore how lower wage workers experience their jobs and workplaces in relationship to factors that affect weight, whether it's leisure time, physical activity, eating patterns, coping with stressors at home and in the workplace, etc. So that's really what we wanted to look at. What were the perceptions of workers in terms of how they were experiencing their work environments, and then the impact that that had on their ability to be healthy in terms of weight status?
Good morning. My name is Suzanne. I am the board chair for Boston Workers Alliance, which is a member-led organization located in Grove Hall of Roxbury in the Dorchester area. Now, I had the opportunity to provide 2 workshops, 2 focus groups, and 2 interviews, one-on-one interviews. And some of the findings that were interesting, although these human service workers were outreach workers, and they weren't sedentary, unless they were in their car, they still had difficulty with eating healthy.
Buenos días a todos, mi nombre es Guadalupe Montesinos, soy miembro voluntaria del Comité Ejecutivo del Centro de Trabajadores de Mascoch.
Good morning, everybody. My name is Ana Montesinos. I'm a volunteer for the Worker Centers of Mascoch.
Me interesé en participar en el programa de obesidad.
I was interested in participating in the obesity program.
a invitar personas para participar en el programa,
to invite people to participate in the program,
pues soy una persona de que también yo he vivido la misma historia que acabamos de contar.
because I'm a person who went through the same story that you just heard.
Trabajaba en un hotel
I worked in a hotel,
y allí muchas veces
and many times
teníamos que, no nos quedaba tiempo para comer,
we didn't have time to eat
porque el exceso de trabajo
because the work was, we had a lot of work,
y la presión que teníamos a cada momento para que termináramos el trabajo.
and the pressure that we have to finish the work.
Muchas veces mi compañera y yo
A lot of times my co-workers and I,
teníamos que acudir a las máquinas de comida rápida,
we had to go to the vending machines,
ahí donde sacábamos papitas, galletas,
and we took
sodas,
chips, crackers, sodas,
y eso no ayuda nada a la salud de nosotros.
and that doesn't help to our health.
Ahí he visto cómo mis compañeros.
Thank you, Ana. I would like to introduce now Guadalupe Montesinos, which was one of the research participants and who will give you a first-hand glance at the experience of a low-wage, hard-working workers. Guadalupe.
Ok, buenos días, mi nombre es Guadalupe Montesinos.
Good morning, my name is Guadalupe Montesinos.
He estado como voluntaria para UMass-Coach,
I'm a volunteer of UMass-Coach,
pero cuando estuvimos reclutando a las personas para el proyecto de obesidad,
when we were recruiting people for the obesity project,
pasó de que también me sentí como una de esas personas, porque
happened that I felt like one of these people. Many times there are people who go to a restaurant but they don't know the word that you put to get that food ready on time.
la mayoría de manager o jefes, lo que le importa nomás ganar ellos, y no le importa cuánto pueden hacer para los empleadores.
The majority of managers or bosses, they care about making money, but they don't care about what they can do for the employees.
Bueno, esa es parte de mi historia, es muy larga, pero podría,
That's part of my story. My story is very long.
no me gusta porque son cosas de que muchas veces me podían hacer llorar por mis hijos, por mí.
I don't like it because sometimes it makes me cry.
Y si muchas veces si uno no tiene siquiera tiempo de ir al baño, y mucho menos va a tener tiempo de hacer ejercicio.
Many times if you don't have time to go to the restroom, you won't have time to exercise.
As you can imagine from what you heard today, some of the more conventional recommendations that come out of research and come out of other community and policymaker strategies are not quite the perfect match. The issue of focusing on sedentary lifestyles and encouraging people to take stairs while they're at the workplace, or to make sure that they walk to work, or to go to the gym after work and make sure they spend that time doing exercise, just really didn't resonate with what we heard from the workers today, of course, and in our study. And so workers did have things to say about what was needed that would actually really have a measurable impact. And of course, given that many people are really focused on making sure that those that are disproportionately impacted by overweight and obesity, that we really need to listen to their recommendations, as well as others that we derive from the stories that they told. So Miriam and I will bounce back and forth some of these recommendations.
So for this next portion of the program, we have a very distinguished panel. We're very grateful that you all came out today. My name is Suzanne Nobrega. I'm with University of Massachusetts Lowell. I'm a research staff member with the Center for Promotion of Health in the New England Workplace. which is one of the 4 total worker health centers around the country. And that is an agency within the Centers for Disease Control that Casey Chosford leads. I'm going to be serving as the moderator, as Marcy said. So our 6 panelists are going to reflect on the findings of this study and bring their own perspective from where their roles are, either as policymakers, labor leaders, researchers, and business. So we're going to hear reactions. For generally, the first 3 speakers are going to present the public health perspective on the federal, state, and local level. Then we will have, they will be followed by the voices of labor, business, and then research. So I'm going to introduce each of the panelists, and they will have a few minutes to talk, and then we're, at the end, going to provide some chance for question and answer again.
Very much. I really appreciate the opportunity to come and join this discussion because it's such an important discussion. And considering how this resonates for me, I'd start with the focus. The idea that this is an opportunity, this report, to provide some light on largely unexplored and unaddressed associations between worksite environment and obesity and the welfare overall for workers. I'd speak then about and applaud the method of this study. The fact that this is a community-based participatory research study that focuses, that uses qualitative research. So the fact that we're partnered, this group is partnered with the people that are really in need and really need a different way to give voice to the concerns that they've had, largely from people that don't often have a chance to voice their concerns, and empowers people that often don't have their strength tapped into. It says a lot, the method in which people have chosen to explore and understand and highlight what's happening from a population that very rarely is in the public eye. We don't hear about it in our campaigns and our media too much, and so here is a beginning, hopefully, of a new and much more important call.
I wear lots of different hats, and so that's the fun part for me about being here today, because I'm a business owner, I'm an advocate for health promotion at the local and national level, and I have the opportunity to see lots of different perspectives on the way we can make changes in our society by improving the health of our citizens. In my role as the representative today on behalf of the Alliance for Business Leadership, this is a small organization based here in Massachusetts, but reaching outside of the Commonwealth as well. And one of the key initiatives of this group of business leaders is around health promotion. And I specifically encourage them to call it health promotion, because that's really what we need to be doing. And I just want to read for you the specific elements of the work that this group is doing. So as Alliance leaders, they're taking active roles in this area by embracing health and wellness campaigns, tracking return on investment, and working with insurers to deliver savings based on outcomes.
So Enid will present the labor perspective on the critical role of working conditions in ensuring health and safety.
Thank you, and once again, thank you to all the sponsors for shedding a light on what is really, I think, a very critical issue. And as a union person, I'm a little late in this discussion because, wellness is one of like 100 things we care about. But I want to kind of talk a little bit about our evolution as SEIU in terms of our thinking. At our convention this year, our national convention, the Service Employees International Union, which is a union of about 2.2 million workers, actually passed a major initiative around wellness promotion, because we have 1.1 million healthcare workers, and healthcare workers tend to often be some of the unhealthiest workers. For me, this is really a crisis, because I look at our members, obesity, hypertension, diabetes too. We can go down the list, and it's totally a critical matter for our union, and I like to think that we take a holistic approach, not just about wages, because I can get a good increase for somebody, but if they're not going to live to be a grandmother, that's not going to help.
So I'd like to bring in the research perspective now. We have Aviva with us, who is Professor of Public Health and Dean for Public Health and Professional Degree at Tufts University, Tufts School of Medicine. And Dr. Must has been involved in population-based obesity research since 1988, directing multiple federally funded research initiatives, and we would love to hear your perspective.
Thank you. When I was asked to sort of give the research perspective, I thought, well, there's either a lot to say or nothing to say, because I think the drivers are pretty clear. There are lots of interesting research questions, and researchers can always find more questions. But I have to say it's really exciting to see a piece of such good qualitative research used to surface issues for people in the workplace and to use it as a foundation for action. And I think very often research happens in ivory towers and we talk to each other and the noise just sort of bounces off the walls. So I wanted to add my compliments to the researchers and to the conveners of this workshop today.
Dr. Andre, would you like to comment on the Mass in Motion program, I guess as it relates to some of the most recent nominations?
Can I try from here? Can you
Yes,
hear me?
please.
Yes.
Great. So, in the midst of these challenges that we've talked about this morning, I think one thing that we can take some hope in is that we're living in Massachusetts, living in one of the nation's laboratories on how do we promote health, from making sure a majority of our population has greater access to health care, going now to the next level, how do we have prevention and health promotion lead the way to make sure that we can help people live quality lives, and with that, reduce the cost of health care. One of those frontiers within those Mass in Motion communities and alongside those Mass in Motion communities is working on wellness programs. Working with now 60 companies trying to help them create environments within their work sites to make sure it's easier for employees to take better care of themselves while they're working, recognizing that like students, they're spending a great part of their day at work. The next step is how do we reach low-wage workers? So finding ways to make sure that we can partner, and one of the great other parts of this study is that it brought MassCosh and CPH-NU together, Department of Public Health, to start having those conversations of how we can do some collaborations in ways that help us reach this population in a more meaningful way.
I feel like a lot of the Mass in Motion initiative talks about the environment and policy change, which I think we have a lot of control in the small businesses and the low-wage workers. So I'm wondering, for instance, with the vending machine policies that have gone through, specifically in hospitals and whatnot, what is Boston Public Health and UPH, what do you think is going to be sort of the new frontier to get into these hospitality industries and smaller businesses, and if we're willing to maybe have a new policy for that or something for nutrition, because I think that that's an area that we have a lot of control over, but
well, I could start by saying, so you mentioned the wellness tax credit that's going to be coming into play very soon. That creates incentives for employers to create an environment that can include policy, that can include infrastructure. The idea that creating an environment is a greater lever than trying to have a small class for a subset of the employee population. So we're now working with other partners around the state, including employers. How do we create kind of a seal of approval, the credentials that would qualify employers for that kind of a tax credit. So that's the beginning of a state conversation on how do we create incentives that encourage employers to think more broadly and more creatively, more sustainably around how we have environments that make it easier for employees to take better care of themselves at work.
I feel like the small businesses, specifically in the community that I work with, they are sort of tied as far as their choices, but also making ends meet. And their employees are probably the last thing that they're thinking of, even though that's how they make their money, because of the fact that there's no accessibility to anything. And where I'm only one person coming in helping them with a wellness program, I don't know if there's something beyond tax credits that we can feed them almost, because I pretty much go in there with a pamphlet and give it to them and then walk out. hoping and praying that they utilize it. But, you know, that's something that I think needs to be conveyed, because I know we're all back in our silos doing our hard, important work, but I don't think that the worker or the employee or the owner, CEO of this small business knows that we exist. So,
and they may need some strategies.
yeah.
So the present iteration of working on wellness really works with a toolkit with employers to really first help them do a self-assessment so that they understand where the needs lie and how they may address those needs, and then partners with them with some technical assistance to figure out what would be the right fit for their workplace. Now that's those employers. The next iteration is how do we do that for a broader cross-section of small businesses? Sure. What is it, 95% or so small businesses in Massachusetts are 50 and less employees. That's a whole different calculation when it comes to a shop that has 5 employees. How do you create an infrastructure that makes it easier for people when they're all working full tilt? But there's where we partner with all the stakeholders to make sure that we can come up with those solutions.
Sure. If I could just comment on that as well, because this is an area that's near and dear to my heart. In the field of worksite health promotion, the models that we have and the best practices are all based on research that's been done and great work that's been done over the last 30 years in large organizations. We really don't have any models, and we really don't have any research on what does it take to reduce risk factors and impact employees' health in small businesses. And this is an area that, you know, hopefully, you know, maybe we can have a cohort that's specifically targeted to. We've had numerous small businesses come through the Working on Wellness program, but the majority of those programs, the majority of those participants have been larger organizations, not the small businesses. So this is an underserved population that we really do need to address. And hopefully, you know, with the pieces of the work that are coming out of the National Healthy Workplace Project, which does have some of its participants in small businesses, we can start to see some of these pieces and develop some real models that we know will work. But it's an underserved population that we do need to address.
This is just really the beginning. We don't expect you to leave with anything solved, as was mentioned just previously, but really we want to foment some ideas and be a catalyst for collaboration. So we're going to be dividing into small groups. Oh, I'm sorry. No, I will make sure are going to have the reporters come up to the front, and they will be presenting just simply the 3 recommendations, and that way we'll be able to build and create some action steps. We will be typing these up. We have
most talked about a very broad recommendation is that any public health program focusing on the health of working people needs to address work. So that's kind of the big umbrella recommendation. 2 very specific recommendations that came out of ours was that we need to include experts in occupational health and labor policy, the advisory board for the Massachusetts Prevention Fund, and the group establishing the criteria for the tax credit. So that's a specific recommendation. And then we wanted to know more about the laws, for example, the wage laws, the labor laws that pertain to work. Who's responsible for them? We inform them of the results of this report to promote and develop strategies to promote enforcement. So those were
integrating cultural competency and this idea of having the employer understand the culture and social norms of that worker when they come to the workplace, because we felt that those social norms don't stop at the door of the workplace, but rather enter the workplace. And there's, I think, a dual responsibility to understand it both. And this idea of increased collaborations between community agencies, federal agencies, and educational institutions.
Just to get a sense of people that actually feel like they have some capacity and energy to work with another group and move ahead on some of these issues, and then we can get some more specifics. You want to raise your hand? Again, no pressure, but okay. So that's a great response. Is there any sort of a final word or thought before we come to conclusion?
I just want to say the importance of continuing to tell the story. I just want to thank you for that, and we need to tell more.
And speaking of stories, thank you for saying that, because I wanted to give really a huge thanks to Guadalupe and to Anna for joining us here. So there, again, to our panelists who worked really hard to review the report in advance, to have a lot of discussions with us, to give their very thoughtful comments, traveling from all over the state and from Georgia, so a huge hand for all of you. And we will be sending out notes. We have a participants list. If you weren't on it, we can add you. And we will be taking names before you leave of people that want to continue this dialogue and do the best we can to help funnel you into keeping this going so we can see some actual change. So thank you very much.